Wondering how to have a speedy recovery after your root canal procedure? Let's talk. My name is Whitney and I'm a dental hygienist here to talk about post-op instructions, home care instructions after a root canal. First things first, of course, as with any dental procedure, your dentist or your endodontist, in the case of a root canal, is going to give you specific directions to follow once you get back home after your appointment. Make sure you always follow your individual instructions from your individual provider. And this video will be a generalized overview of the 5 most common recovery tips. Starting with number 1, try to make sure you avoid chewing on the side of your mouth with the root canal, especially for the first 30 minutes after your appointment. Mostly due to the temporary filling or temporary crown, once your dentist fixes a permanent crown over the tooth, usually a couple weeks later, then you can go back to chewing on it normally. But until then, we want that temporary to stick in place. So if possible, chew on the other side of your mouth. Number 2, so hopefully you ate before your appointment, because it's okay if you didn't. But the reason we like you to eat prior to your appointment is because until the numbness wears off, of course they numbed you up, they numbed up your tooth with local anesthetic, we usually recommend you don't eat or chew anything until the numbness wears off, because you can accidentally be biting your tongue or cheek repetitively without knowing. And then once the numbness does wear off, you'll be like, ow, what happened to my tongue? So if you did not eat beforehand and you're super hungry now, best advice is to stick to soft foods that you don't have to chew much to reduce your risk of biting your tongue or cheeks. And then once the numbness wears off, until you can get your permanent crown, number 3, watch what you're eating in general. Even if you're really good about chewing on the other side of your mouth, some great food ideas after a root canal are soups, yogurt, eggs, avocados, mashed potatoes, applesauce, bananas, smoothies, ice cream, hummus, oatmeal, soft foods. And foods to always avoid after a root canal are sticky treats. Sticky stuff can pull off your temporary crown or filling. Don't do it. We just said how we don't want that. Chewy textures. Even if the food isn't technically sticky, but you have to chew it a lot to eat it, it could still create a suction around your temporary and pull it off. Again, we don't want that. And hard or firm food. And like I said, even if you're trying to eat on the other side of your mouth, you're still exerting pressure on your teeth, all of your teeth, right? And if that brittle root canal tooth breaks before your dentist has a chance to put the permanent crown over it, that's no good. And I have a full list of foods with lots more recommendations to get you through those couple weeks before you get your permanent crown. The full list is on my website, teethtalkgirl.com, if you'd like to learn more. But back to this video. Number 4, be sure you're brushing and flossing around each of your teeth daily. Even the tooth that had the root canal, it can still get plaque stuck to it and it can still develop cavities on the enamel as well. So don't skip cleaning that tooth at home. Pro tip, now if you have a temporary crown and your dentist says specifically, because of the way it's stuck on temporarily, there are some cases where they don't want you to floss around that one tooth until you get your permanent crown. So ask exactly the best way they want you to clean around it. If you're at home right now and you're like, shoot, I'm already done with my appointment and they didn't tell me how to clean around it, just call them and ask. No worries, it's a super easy question they can answer over the phone for a patient of record, especially a patient who was just in. And lastly, number 5, if you are having discomfort, generally any discomfort will be best managed with an over-the-counter pain reliever and or an anti-inflammatory as instructed by your dentist. Also, a cool compress helps, and rinsing with warm salt water. Rarely, if ever, would you need an actual prescription painkiller for after a root canal. The over-the-counter pain meds, the cool compress, the warm salt water rinse is all you need. And all of that being said, the most common reasons why you might be feeling some type of pain after a root canal procedure is usually not because of the tooth itself. It's actually usually due to things like where the local anesthetic was injected. Hands down, the most common reason why people are sore after a root canal is because of the injection site that they use to numb up your tooth. It's kind of like having a sore arm after a shot, The skin or the tissue needs to heal. Another uncomfortable feeling post-root canal can be from holding your mouth open for too long. Your jaw joint can get sore, right? Especially if you were having to strain it by opening wider for a hard to reach back tooth. Usually, to lessen the strain on your joint, your dentist will use a bite block that you rest your teeth against. So if you happen to catch this video before your appointment, be sure to ask for a bite block to use during the procedure if you're worried about your jaw. In all, generally speaking, some mild soreness can be expected after a root canal procedure. And it should get better every hour, every minute it's healing and it's getting better. But if you're in serious pain and it seems to be getting worse each day instead of getting better, especially to the point where there is shooting pain through your jaw or tooth, throbbing pain, that's usually not normal. Always call your dentist's office if you are experiencing anything opposite of healing. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. If you want more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.